If you had some advice that you could give from a patient's perspective, and maybe you're talking to a policymaker or healthcare providers, but how can we do better in this area as it relates to whole person care, culturally competent care?
I would definitely say take your patients more seriously and not just like one off, like, okay, bye. A lot of the times they just do a couple tests and they're like, oh, well, we can't find anything. So let's just, move along. And there needs to be more conversation as well. A lot of the doctors will come in and talk to you for, like you said, like 15 minutes. And then it's like, okay, well, we can't find anything wrong, so just go. And it's like, no, like, let me explain everything. Let me explain how I'm mentally feeling, how I'm physically feeling, how stressed out I'm feeling, how emotionally I'm feeling. And there's just so many different layers to just one, if you come in and say, oh, well, my hip hurts. Okay, but why? Like explain more to it, not just, okay, let's do an x-ray and you can leave. Like there needs to be a lot more conversation going on between the patient and the doctor. There needs to be a lot more understanding where it could also be stresses that relate to work. It could be stress related to family, to loved ones, to kids, to spouses. There's so many different things on top of that that's more than just, oh, hey, like I just need a prescription and you can go. There's so much more conversation that needs to be had. And I really wish that a lot more healthcare providers would have that conversation with them. I know they don't always have the time, they're busy, but at least a little bit more compassion, a little bit more understanding going about when it comes to patients.
I appreciate that. And you're right. The time is an issue. And I will tell you, as a physician and as somebody who has tons of physician friends, it causes internal conflict within the doctors because I don't know any doctor that got into this, for any reason primarily other than to help patients. And so to be placed in these situations where you know that you're falling short of providing the care that your patients need is actually quite disturbing.